Patty, I know one of the real traumatic things that can affect people during chemotherapy is the possibility or actual hair loss. Can you comment more on that issue for us?
And this is a problem and a concern for not only women but men as well. And each chemotherapy agent can affect hair loss at different intervals, and some chemotherapy agents don't cause hair loss at all. Sometimes the patients may experience some scalp tenderness just prior to experiencing some hair loss, but generally it's something that they might experience around 17 days or so after the majority of the chemotherapy agents when they start. But that can vary, and some patients, as I say, may not experience the hair loss at all. They may notice that when they start having hair loss that they may want to go ahead and see a barber or a beautician and go ahead and have their hair shortened so that they aren't dealing with a lot of loose hair that can be problematic just in their daily activities. We encourage our patients, especially women, to go ahead and seek consultation on obtaining a wig. We provide you with a prescription so that you can submit that along with the cost of the bill for the wig to your insurance company, and most insurance companies will pay for those, and they call them scalp prosthesis. But you might want to check with your insurance company and your information to see if they do cover that. But by doing that, then you have a head start. You can match the color of the wig to your hair, and also the style, so that gives you a little bit more confidence when you go out into your daily activities. Your hair will grow back when we stop your chemotherapy agents. That's important to know. And generally the hair will start coming back within a month or two after that. And by the time that you're ready to come back, sometimes for your first office visit with the doctor, your hair will be back enough so that you've already had maybe a trip to the beauty parlor.
What about women who like to dye color their hair or permanents? When should they consider that after their hair is growing back?
Well, I've had this question is asked a lot because, you know, hair is a very important thing. We usually say 3 to 6 months after you stop your chemotherapy, then you can always start considering doing that. Your hair is still sensitive after you, and obviously that hair follicle, we need to protect that until it is stable enough that it can tolerate that. So if you have any questions, just ask us. Sometimes consult with your beautician. They are very knowledgeable and can use products that are not as harsh as others when you do start back.
I think when we first opened up the video, we talked about chemotherapy and how it affects rapidly dividing cells and therefore rapidly growing hair.
Absolutely.
And that generally would include the hair on your head. It would include leg hair, for example, especially for women. What about eyelashes and eyebrows? Women worry about that sometimes.
That is a big issue, and those can be affected. You can lose both your eyelashes, and maybe not in the total loss, but you can see loss of eyelashes. But you can see thinning, significant thinning of the eyebrows. And that is one of the things that they will help with the Look Good, Feel Good program, is they actually have teach you how to apply cosmetics in a way that looks more natural in terms of replacing the look of the eyebrow.
Patty, I know that we also have some support services often available for patients who have lost their hair, for example, with cosmetologists. Can you tell me more about that?
The Look Good, Feel Good program is a group of people who come to a setting and present information that is very helpful to all of our patients. They talk about the use of scarves and using wigs and hats that help to support any kind of needs that people would have during that time. Those sessions are scheduled, and we can let you know exactly where they're going to be and when they're going to be. And in your teaching pack, there's information that you can refer to with phone numbers that you can call to get local areas that are having them in a timely fashion for you and your needs.